Okay, there we are. Went to the clinic this morning and my nerves are a little bit shot because I'm worried. And my nerves are a little bit shot as well. Um, I may have neuralgia, like a pinched nerve or something. And it's either in my elbow as well as my shoulder, my whole arm up the side into my neck and the side of my neck. Or I've got tennis elbow and this neuralgia thing. I don't know. But I went there with these aches and pains and complaints to speak to the nurse at the Beacon Bay Clinic, and I've got a referral from her to see the Beacon Bay Clinic doctor in 9 days' time. Although I'm a bit, nerves are shot again, I'm a bit worried because normally in the book they write something like a doctor's appointment, but it doesn't look like she's written doctor's appointment. It's something else. So I hope it's not just an appointment to see how I'm doing and then only make a doctor's appointment. But all that said, we don't have money, we don't have medical aid, even though we have to wait. We're grateful that we do get free medical care. But when I went to the doctor, this is not the doctor, the nurse, I wrote down like a whole bunch of things so that I could tell her, explain to her what's been happening here. And this is pretty much what I told her. I made some notes and then she took some notes from my notes. But for example, I wrote, I'm nearly 56. I had chickenpox when I was 15. I had shingles in my middle upper back on my spine when I was 30. I had tennis elbow in my right elbow at 33, and she did ask me what did they do, what did the doctors do when I had the tennis elbow in the right elbow. I said they gave me a cortisone injection, and a month later another cortisone injection, and that sorted it out. And then at 42 years old I had some horrific burning type pain all the way down my right arm, which didn't go away for like a week. Eventually I went to the doctor. These are the days when I still had medical aid or enough money to see normal or private doctors. And the doctor said, based on the chickenpox and the shingles on the spine area, that this was very likely, what's it called, herpetic neuralgia. And he prescribed a medication that could help with that. And he prescribed for 1 month, and he said if it doesn't work in 1 month, I may have to come back, and I could possibly have to be on this medication for the rest of my life. Sort of like nerve damage or pinching nerves medication to help me with that. Luckily, after 1 month, when I was 42, way back in 2011, the 1 month medication did help. But since then, about 2 years ago, I was diagnosed with arthritis. A little over 2 years ago, with arthritis in my neck. And then about 6 months ago, when I had a sore hip, orthopedics at Fred did another x-ray and said it's all over. The arthritis is in my neck, my spine, my hips. Well, the doctor said it's everywhere. What still hasn't been dealt with, and also even with this nurse, I was telling her about this, but she didn't take notes about it, is I'm having little crackle noises in my skull and at the base of my skull. I think where the brain stem is, possibly at the very top of my cervical spine, and it's also like a bit of a lump on the right hand side here. I've got two. That's normal, but the one feels a little bit bigger and harder, or it's painful when I push on it. But most troubling right now is this arm thing happening down the left. There's a big knot over here as well, and then in addition to this, I'm having across here and down here, I'm having these little electric shock things that, well, this one happens once or twice, maybe 3 times a day. This one is more frequent across here, 5-6 times a day. A sharp, very quick electric shock type of feeling. And anyway, so she gave me some pain medication, some calcium, and something else. And in addition to this, when they took my blood pressure before my visit to the nurse, it was pretty high. I don't think I've ever had a blood pressure that high before, which got me more worried, and I am already an anxious person. I do take anti-anxiety medication as well. And I was dying to ask her, even though Tony had already tried to calm me. He said the pain that I've got in my arm is probably causing my blood pressure to rise, and I tried to confirm that with the nurse, and she agreed. The blood pressure being high is because of the pain that's in my arm, in my neck, and everything. And apparently the other tablet that she prescribed can help with that. And that was it. We're on our way home, and we stopped on the side of the road in our usual little quiet spot under the pine trees to do some videos. And hopefully by next week, Thursday, 9 days time, when we go back, hopefully I do see the clinic doctor and get a referral to probably a neuro clinic or something, a neuro clinic or neurologist at Frere, because the orthopedics just do x-rays and give me pain medication, that's it. So yeah, and that's it. You wait, stay here. We've got a visitor, and I'm going to say, please subscribe, watch our
Comment,
videos all
like.
the way through, like, comment, and all of those things. And yes, subscribe so you can find out what happens to me, and hopefully my nerves won't be so shot in a while. Tony
No
knows
comment.
I'm always anxious. Okay, thank you for listening, watching. Bye bye.